The World Health Organization reports 230,000 new coronavirus cases were reported across the globe Sunday, the highest single-day total since the pandemic began. The United States reported 60,000 new infections Saturday, 68,000 Friday, the two highest totals to date. Florida recorded over 15,000 new coronavirus cases Sunday, setting a new single-day high for any state.
20% of all COVID tests in Florida have been positive over the past 7 days.
Remember, the experts say it should be near 5% before businesses and governments.
The U.S. continues to shatter coronavirus records, with 41 U.S. states recording increasing cases of COVID-19. More than 67,000 new cases were reported Wednesday, nearly tying the previous daily record. The official U.S. death toll is now over 137,000, shattering any record in the world. At least 8 states set new single-day records over the past week: Alabama, Arizona, Florida, Mississippi, North Carolina, South Dakota, Texas, and Tennessee.
To Texas now. Houston's mayor is calling for a citywide shutdown as ICUs in the area hit 97% capacity. Hospitalizations statewide have hit a record for 14 days straight. Now, the Department of Defense says it's sending around 580 medical personnel there to help. And in the state's hard-hit Rio Grande Valley in the south, this funeral home director says he has been overwhelmed with requests.
We normally do about maybe 6 to 10 funerals a month, and right now we're doing almost 10 a week.
Nationally, the average daily rate of coronavirus deaths rose nearly 42% last week.
Officials in Texas and Arizona have put out calls for refrigerated trucks as morgues overflow with the bodies of COVID-19 patients. On Tuesday, the director of the Centers for Disease Control and Prevention, Dr. Robert Redfield, made a dire prediction about the U.S. epidemic, which is already the worst in the world.
I do think the fall and the winter of 2020 and 2021 are going to be probably one of the most difficult times that we've experienced in American public health.
In California, the coronavirus death toll at San Quentin State Prison has reached 9 after 2 more prisoners died Saturday. Nearly 1,500 men held at the prison have now tested positive. Dozens of critically ill prisoners have already been hospitalized. On Friday, California Governor Gavin Newsom ordered the release of 8,000 people from the state's prisons by the end of August. Researchers at Johns Hopkins School of Public Health have found prisoners are 3 times as likely to die from COVID-19 and 5.5 times as likely to get infected as the general population.
New report saying that the White House is ordering hospitals not to send their data to the CDC, but to send their data directly to Washington, D.C. for a database. That's what their job is.
The New York Times reporting the Trump administration is ordering hospitals to bypass the CDC and send all patient information to HHS instead. This cuts out the CDC and may make this data much harder to access for the medical community.
And that is that the Trump administration no longer wants hospitals to give their data of how many patients they have, of how many hospital beds, of the ventilators, how many patients are on them, to the CDC. They want that information to go to them at the HHS. So HHS within the Trump administration. And that data, which is now public through the CDC, would not be public via HHS. And that means that the information the modelers use, the information that I assume you use, the information that we report, the information that allows us to see all of that on our screen, on the side of our screen, this feels like something bad, a shift that is for less transparency.
We talk about the developments overnight in terms of the spread of the virus. People can see the daily death count, 136,000 deaths total, 900 new deaths, 11 states showing record hospitalization. The IHME model, which is the model that most people have been looking at, they came out with a new forecast overnight suggesting, and I think I have this right, 220,000 deaths that we can expect by November at this point, which is a big jump in their modeling. Why?
Yeah, I mean, this is for all the reasons you guys have been talking about on the program for some time. There's significant surges in several states, Florida, Texas, Arizona, and California. But as we look at the model, there's a longer list of states that are being affected as well: Louisiana, Kentucky, Mississippi, Nevada, New Mexico, South Carolina, Tennessee, Utah. I think it doesn't even reflect how significant the situation has become, because you may have a significant surge one week and then a slight drop, and it looks like you're improving, but overall the trends have really been going up just about everywhere.